Good morning, Chair Price and subcommittee members. I am Kathryn Haines, the Health Equity Manager for the Virginia Interfaith Center for Public Policy. Delegate Willett, thank you so much for being the patron of HB 1904. This bill was brought to the Virginia Interfaith Center at the request of South and West Side Virginia Interfaith advocates impacted by, and moms impacted by hospital closures. The VICPP drafted this bill to address a problem in maternity care deserts and enable nursery and OB units to remain open. This is not a midwife bill or a physician bill. This is a mom and baby bill. And to keep things, although I should say it's worth pointing out that the research shows that states with more integrated care, including midwifery care, do have better outcomes. But I would like a mom who when a closure happens, puts the safety of her baby at risk, speak next. So thank you so much.
Hello. So for one, I just want to mention that I'm running on 2 hours of sleep. Nursing this little one throughout the night, and I had to drive all the way here, which is 3 hours away. So I've been on the road since 4:30. So with this, it will. When the closure happened back in November, myself, along with other moms, they. You don't know where you're going to go, and you shouldn't have to worry about that type of thing. Like when you were pregnant, like the last thing you should be worrying about is where you're going to give birth to your baby. Like that should just be a no-brainer. Like that should be the last thing you should be worrying about. And to have a closure due to the fact that you don't have a provider to give newborn care when there are people in our community that are qualified to do that job just makes no sense to me. And I just can't wrap my head around why that's a thing. And I don't know how any of this stuff works. I don't. And this just seems like such a simple solution to me. And so I just wanted to tell you guys, like, this is something that's very important to me. Like I said, I came here on 2 hours of sleep, driving down the highway with my newborn, and I'm sorry. It just shouldn't be something that we should have to worry about. It's something so simple. So if you guys could vote in favor of this bill to help myself and future moms and all the moms that are currently pregnant now, to make sure that that's the last thing that they have to worry about is where am I going to birth my baby? If my hospital closes, like, am I going to have to drive 2 or 3 hours just to get care? Like, not everyone has the privilege to get in their car and drive somewhere, like, or take off work. And I don't think that should be anything that they should ever have to worry about. So, thank you.
Thank you.
Good morning, Madam Chair, members of the committee. Aimee Perron Seiberg. On behalf of the physician community, I worked with the ER doctors, the pediatricians, and the OBGYNs, and we appreciate Delegate Willett and his office and the Interfaith Center and the nurse midwives for working together and coming up with this substitute, which we think is a really good fix for the problems that we've all seen today. So thank you. We support the bill.
I really appreciate the committee's time, and I really appreciate the testimony heard today. I think this is going to help a number of moms across Virginia, particularly those in rural areas, and thank you for your time.
And particularly to our citizens that gave their testimony today. You did an amazing job, very convincing, so you do know what's going on. So thank you for being with us today.